Disease of lymph node. These disease of lymph nodes among the oral involvement, they are most commonly important disease which involve in the lymph nodes. It is a Hodgkin's lymphoma, also known as Hodgkin's disease, or the next form is non-Hodgkin's lymphoma. Hodgkin's disease, it is usually a disease which primarily involves lymph nodes, but otherwise there are even some conditions where occasionally it involves or secondarily it involves the extranodal involvement, that is the organs other than the lymph nodes. And most of it constitutes Hodgkin's lymphoma. It constitutes 8% of all the amongst all the lymphoid neoplasms. It comprises of 8% of the disease, and it occurs in bimodal incidence. That is, it is seen in two age groups. That is, first peak incidence occurs in 15 to 35 years, in between 15 to 35 years of age group, whereas the next age group it involves above 5th decade, that is from starting from 41 years to 50 years or above it 50 years. So there's a bimodal incidence of Hodgkin's lymphoma. The next, coming to the gender predilection, usually we see that males are more commonly affected when compared to females. And the most characteristic feature of Hodgkin's lymphoma, microscopical features, if we consider the histopathological pictures, there's a prominent or characteristic cell which defines it as an Hodgkin's lymphoma, known as Reed-Steinberg cells. They are also known as Dorothy Reed-Steinberg cells, which have been identified, that person who has named it. So these are certain cells which are usually found in Hodgkin's lymphoma. Other than that, it's not necessarily that all the Hodgkin's lymphoma require the presence of Reed-Steinberg cells for its diagnosis, but necessarily it is one of a characteristic or criteria for to identify to diagnose a patient infected with Hodgkin's lymphoma. Coming to the classification, it has been classified under two classifications. One is the RISE classification, and then is the WHO classification. In the RISE classification, we see four groups it has been classified into. The first one, it is a lymphocyte predominance type, then coming as a nodular sclerosis type, then is a mixed cellularity type, and the last classification subtype is lymphocyte depletion type. Coming to the next WHO classification, they are broadly classified into two groups, that is a nodular lymphocyte predominant Hodgkin's lymphoma, and then is a classic Hodgkin's lymphoma. In the classic Hodgkin's lymphoma, they have subdivided into the all other four types which have been included in RISE classification. So there is a classification of Hodgkin's lymphoma. Coming to the various Reed-Steinberg cells, that is a variance of Reed-Steinberg cell. Classically, a classic Reed-Steinberg cell, it is usually a cell which is composed of, which gives an oval-like appearance. This oval-like appearance is because the nucleus, it forms a bilobed, that is, there's a mirror image of a nucleus with centrally placed round to oval darkly stained eosinophilic nucleolus like structures present within this nucleus, and this because of this nucleus and presence of scanty cytoplasm surrounding it, it gives a owl-like appearance because of this bilobed mirror image like nucleus. So this is what is Reed-Steinberg cell. Then coming to the lacunar type of Reed-Steinberg cell, it is a variant of Reed-Steinberg cell where we see that it's similar to that of Reed-Steinberg cell, but rather here we see that there is a perinuclear halo-like kind of thing around the central nucleolus-like structure, because of which it appears that it is it's suspended within a perinuclear halo. So it is within a lacuna, so it is known as lacunar type Reed-Steinberg cell. Coming to the next variant, it is a polypoid type of cell, which is also known as popcorn type of cell, because the nucleus here appears as a popcorn. It is because of the multilobulated nucleus and this with a scanty cytoplasm, which is almost appears as clear or pale when viewed under a microscope. Because of this, it gives an appearance of a popcorn appearance. So it is known as popcorn Reed-Steinberg cell, or otherwise popcorn cells, or also known as polyploid cells. Then coming to the last variant, that is the Reed-Steinberg cells, which appear pleomorphic. That is, they appear in a varied or multiple morphological appearances. It can appear with nuclear atypia can be seen. So these are certain variants of Reed-Steinberg cell. Coming to the morphologically, what we observe clinically in a patient with the Hodgkin's lymphoma, it is we see that most commonly involved lymph nodes. They are the cervical lymph nodes. Then coming the supraclavicular lymph nodes, and then comes the axillary lymph nodes from neck to the. It involves the shoulder clavicle bone, and then towards the clavicular bone, and then towards the axilla. So these are certain lymph nodes which are most commonly affected. And other than that, it also involves extranodal involvement. That is, it could involve other than a lymph node area also. And initially, when the lymph nodes are being affected, we see that on palpation, these lymph nodes, they appear discrete and they appear as separate structures. And later, these lymph nodes, they fuse together and form a matted mass kind of structures, which can be observed under a microscope or otherwise with further various diagnostic aids. Extranodally, we see that if it involves other than the lymph nodes which are being involved by Hodgkin's lymphoma, then we see it appearing as a discrete tumor, that as a separate elevation of a mass or a tumor, and it could also be as a diffuse enlargement, that is fusion of 2 or 3 structures and resulting in a diffuse enlargement. And gross specimen, that is when a biopsy is being sent to a lab, we find that the specimen, it is almost lobulated kind of thing, and on cutting the section, it appears grey whitish in color, and it gives a fish flesh like appearance, that is, it provides as a scaly like appearance, so it is known as fish flesh like appearance. So coming to the histopathological variants, that is based on the classification by WHO, that is a classic Hodgkin's lymphoma. Among the classic Hodgkin's lymphoma, it is of first type, it is of lymphocyte predominance type. As the name itself suggests, that is, we find dominant cells, that is predominant cells occupying in this disease. It is in this variant of histopathological feature, it is the lymphocytes. And these lymphocytes, they are usually small lymphocytes, and other than that, there are also other mononuclear cells known as histiocytes can also be known. They are nothing but tissue macrophages. Coming to the subvariants of this lymphocyte predominant type, we find nodular type. As the name itself suggests, it appears as a discrete nodules, or otherwise nodules which fuse together and give rise to a bigger nodule. That is, these neoplastic cells, they are present within the nodule and they give a nodular kind of appearance. So a nodal kind of architecture is seen usually in a lymph node, but this nodal architecture is being replaced with neoplastic nodules in a nodular type of lymphocyte predominant type of Hodgkin's lymphoma. The next coming is a diffuse form, which is seen as lymphocyte predominant type. We see that the cells are diffusely arranged, that is, they have been scattered throughout. It's not like they have not, as in that of a nodular form, which are being circumscribed to a concise to a particular area, but rather they are diffused or scattered together throughout the lymph node, whichever is being involved in Hodgkin's lymphoma. The next type, it is a nodular sclerosis type, where we see the other two variants, that is bands of collagen can be seen. In this bands of collagen, there is a fibrosis of this collagen, that is, the collagen, they bind together or they hyalinize themselves, amongst which these hyalinized layers, there is also the cells, they have been disposed or scattered throughout, can be seen among these fibrosed areas. So this is bands of collagen type of variant under the nodular sclerotic type. Coming to the lacunar type of Reticular cells, that is, in the nodular sclerotic type, that is where we see the presence of nodules which is composed of this neoplastic cells, and other than that, there's presence of fibrosis, but we also see that there's presence of lacunar type of Reticular cells, that is Reticular cell with a characteristic perinuclear halo around it, looks like it's being suspended within a lacunae. So there is the lacunar type of Reticular cell. And coming to the mixed cellular type, it usually we see that as the name itself suggests, we see there is mixture of cells, that is varied population of cells can be seen, which is polyclonal. That is most commonly seen cells. They are the lymphocytes, they are the monocytes. Among the they are the mononuclear cells. Among this mononuclear cells, they are the histiocytes, eosinophils, neutrophils, plasma cells, as well as lymphocytes. All these are composed within a mixed cellularity type of Hodgkin's lymphoma. And usually these cells, what they do is they replace the complete architecture of the lymph node. That is, the normal architecture of the lymph node cannot be observed, but rather these varied population of cells can be observed in mixed cellular type of Hodgkin's lymphoma. Then coming to the lymphocyte depletion type, we see that the lymphocyte is completely being depleted. That is the lymph node. There is no presence of lymphocytes within this lymph node. So this is known as lymphocyte depletion type. In this lymphocyte depletion type, we also see other two variants. One is a diffuse fibrotic variant. In this diffuse fibrotic variant, we see that since it is being depleted of lymphocyte, so there are reduced number of cells, so it is known as hypocellular. And then the entire lymph node is being replaced by this diffuse fibrosis. So it is known as a diffuse fibrotic variant. That is, the lymphnodic structures cannot be seen. Rather, there's complete fibrosis. That is, the collagen fused together, they hyalinize and result in a formation of fibrosis. So this is what is observed in lymphocyte depletion type and in the variant of diffuse fibrotic type. Coming to the next variant, it is a reticular variant, where we see that there is presence of pleomorphic histiocytes. That is, the histiocytes, they appear in various morphologies, and other than that, we also see pleomorphic lymphocytes and Richtenberg cells. So this is what we see in reticular variant. So this is a classic type of Hodgkin's lymphoma and their variants with subvariants. Then coming to the next type, that is a nodular lymphocyte predominant Hodgkin's lymphoma. As the name itself suggests, that the lymphocytes are the predominant cells which are seen in this nodular lymphocyte predominant Hodgkin's lymphoma. And other than that, we also see neoplastic cells which form in a proliferate and result in a formation of nodular growth-like pattern. The lymphocytes which are present predominantly, they are the small lymphocytes and with a few number of Richtenberg cells when compared to that of the classic HD, that is a classic Hodgkin's lymphoma. We find few number of Richtenberg cells, since lymphocytes are only the dominant cells. Then other than that, the another feature of this lymphocyte predominant Hodgkin's lymphoma is that we find that there's a chronic relapsing course, there's a chronic relapsing course can be seen. That is a stage where there's a lapse, that is lack of lack of manifestations of the Hodgkin's lymphoma and then occurrence. So there's this continuous episodes of occurrence and lack, that is absence, is known as relapse. So this chronic relapsing stage can be seen in case of nodular lymphocyte predominant type, and this condition, that is episodes of occurrence and absence of this disease, might result into a large B cell non-Hodgkin's lymphoma. So these are the features of classic Hodgkin's lymphoma as well as that of the nodular lymphocyte predominant type of Hodgkin's lymphoma. Coming to the histopathological pictures, the first picture shows mixed cellular type. That is, they are mixed population of cells. That is, the lymph node architecture is being completely replaced, and it shows presence of numerous varied population of cells, which could be histiocytes, plasma cells, lymphocytes also, and there's also presence of Richtenberg cell which can be observed. Then next, coming to the popcorn shaped Richtenberg cell, that is, which can be seen in the second picture, which is placed towards the left side, and it appears as a popcorn type in appearance. Then coming to the classic Richtenberg cell, that is which shows a mirror image like nuclei and giving a appearance of a owl like appearance because of the presence of central nucleolus like structure and surrounded by peripheral scanty cytoplasm. Coming to the clinical features of Hodgkin's lymphoma, usually we see that the patient, this Hodgkin's lymphoma, it begins at the lymph node. It begins as a lymph node enlargement, that is lymphadenopathy is seen. Subsequently, this lymphadenopathy, it might drain to the subsequent or adjacent structures, that is, it spreads to the lymphoid, otherwise to the non-lymphoid structures. That is, the affected lymph node, it might drain into the adjacent lymph nodes or the consequently which have been present adjacently, or otherwise into the structures which are present around it. So this is what we see in clinical features, and other than that, a patient can present with a painless and movable mass, and the lymph nodes are usually firm on palpation, that is on movement, they are firm. Can also be seen. Other than that, the other clinical features include splenomegaly, that is enlargement of the spleen can be seen, as well as hepatomegaly can also be seen, that is enlargement of the liver can also be seen. Patient might give a history of low-grade fever with night sweats, as well as unfortunate weight loss can also be given by a patient. And other than that, patient might also experience weakness, pruritus, that is itching of the skin can also be present, and other than that, there's fatigue and malaise can also be seen. So these are the clinical features of Hodgkin's lymphoma. Then coming to the laboratory findings, usually other than the general histopathological findings, we also require the patient to undergo certain hematological findings. In the certain hematological findings, we usually when we observe that on blood examination that this patient presents with anemia, it is a moderate normocytic and normochromic anemia can be seen. And usually the measurement of the serum iron levels, we see that it is very low, whereas the iron stores, marrow iron stores, they're usually normal or otherwise increased in condition. Other than that, there's also marrow infiltration which can be seen since they have a property to drain, the lymph nodes have a property to drain into the adjacent structures. So we see marrow infiltration with these neoplastic cells. And there's also failure and leukoerythroblastic reaction can be seen. That is, the marrow can result in failure of the marrow to promote or to produce other cells because of the presence of the abnormal or altered population of these lymphocytes in conditions like lymphocyte predominant type of Hodgkin's lymphoma. Then the other one is we also see leukemoid reaction, which is a moderate level, and then a patient usually patients they are see the Hodgkin's lymphoma is also associated with certain infections. So eosinophilia is a condition which we see in patients associated with other infections where the eosinophil count is above the normal limit. And also lymphopenia is seen in conditions like lymphocyte depletion type of Hodgkin's lymphoma, where the lymphocytes count is completely reduced. The platelet count, it will be normal or otherwise increased in levels, and there's also elevated ESR, which is also associated with the infectious conditions of the patients. Coming to the immunological abnormalities, we see that there's reduced T cells in case of lymphocyte depletion type, and there's also alteration in the ratio of CD4 to CD8 ratio. So these are the laboratory findings of Hodgkin's lymphoma. So this is a picture showing the FNAC, that is fine needle aspiration cytology from a lymph node biopsy, lymph node where the aspiration demonstrates the presence of various population of cells. It shows various mononuclear cells as well as there's also presence of Ritzenberg cells which can be seen in the slide under a microscope. So coming to the classification based on the staging of this Hodgkin's lymphoma, and it is based on Ann Arbor's staging classification, which includes 4 stages. In that, the first stage, which is categorized into A or B stage. The first stage, it is the involvement of the single lymph node region we see. That is, if the stage 1E, it denotes that extranodal involvement can be seen, where we see there's extranodal involvement, extra lymphatic region or the site where only single site is being involved. Coming to stage 2, it is stage 2, we see there's involvement of 2 or more lymph nodes, whereas in stage 2E, we see there's also extra localized contiguous involvement seen in extranodal organ or the site. Coming to stage 3, usually we see there's involvement of lymph nodes on both the side of the diaphragm. We can see this involvement, whereas in stage 3E, we see that there's localized contiguous involvement of the extranodal organ or the site. Coming to the stage 3S, that is, so if it is associated with splenomegaly, then it is known as stage 3S. And coming to stage 3ES, we see that the features both, that is stage 3E and stage 3S, both of them are being included. That is, extranodal involvement as well as splenomegaly is also being involved in the stage 3ES. Coming to the last stage, that is stage 4, it is being characterized into multiple or otherwise disseminated involvement of 1 or more extra lymphatic organs can be seen, or tissues can also be involved without any lymphatic involvement. So these are the stages of based on Ann Arbor's staging classification. So there's a picture showing Ann Arbor's stage classification, all the stage four stages. The first stage, we can see that there's Hodgkin's lymphoma involving only a particular site, and the next stage, stage 2, where we see Hodgkin's lymphoma on the same side as well as involving that of the diaphragm. Stage 3, we see that Hodgkin's lymphoma being affected on both the sides of the diaphragm can be seen, other than that of the primary region of nodal involvement. And stage 4, we see that it is being disseminated, or multifocal involvement of the extra organ sites can also be seen, along with that of the primary lymph node involvement. Coming to the prognosis, usually the staging and histological subtype, they majorly determine the prognosis. We can see that stage based on the staging, we can give the prognosis. So stage 1 as well as stage 2A, they can give 100% of better prognosis with a 5 year of survival rate. Whereas in advanced stage, we see that there's 50% with 5 year survival rate. And coming to the subvariants of the Hodgkin's lymphoma, where we see in lymphocyte predominant type that there's excellent prognosis, whereas in mixed cellularity type, that is of the intermediate lymphocyte predominant type and depletion type, it is of intermediate prognosis, that is neither good nor bad. Coming to the disseminator type or otherwise the lymphocyte depletion type, there's a very poor prognosis in such cases since lymphocytes serve in an immune host defense function. Their absence results in poor prognosis. Nodular sclerosis type shows a very good prognosis. Coming to the larger mediastinal mass, that is, it gives a very poor prognosis. So this is a prognosis of Hodgkin's lymphoma. Coming to non-Hodgkin's lymphoma, usually non-Hodgkin's lymphoma can be defined as a heterogeneous group of lymphoproliferative malignancies which involves the lymph nodes, lymphoid organs as well as the extranodal organs and the tissues. So it is known as heterogeneous since it involves various areas. Coming to the classification of the non-Hodgkin's lymphoma, it has been classified by the working formulation as well as by the rapport classification. And in the working classification as well as the rapport classification, they have divided into 3 types, that is based on the low grade, intermediate grade and high grade. In the low grade, in working formulation, we see that there is presence of 3 subvariants. That is a small lymphocytic variant, follicular variant with predominantly small cleaved cells, and the follicular with mixed small cleaved as well as with large cell. And coming to the intermediate variant in working formulation, we see that it is further divided into 4 variants. That is, first one is a follicular which shows a large cell, then coming is a diffuse type which shows a small cleaved cell, then the third type, it is also a diffuse type which shows both the small as well as the large cell, and the fourth type which shows diffuse type with large cell cleaved as well as otherwise non-cleaved cell. Coming to the high grade type of working formulation, we see there's 3 variants, that is a lymphoblastic showing the large cell, and that is a lymphoblastic which shows a convoluted or non-convoluted type, then the immunoblastic which shows a large cell, then coming is a small non-cleaved cell which is also which could be Burkitt's or otherwise non-Burkitt's lymphoma. Coming to the rapport classification, among the first low grade type, we see there are 3 variants. The first one is a diffuse lymphocytic variant which is well differentiated. Then is a nodular lymphocytic which is poorly differentiated. Then it is a nodular mixed type which shows a lymphocytic as well as histiocytic involvement of the cells. Then coming to the intermediate grade, we see nodular histocytic type, then is the diffuse lymphocytic type, then it is diffuse mixed type, and then it is diffuse histiocytic type. Coming to the high grade, it involves diffuse histiocytic type, diffuse lymphoblastic type, and the diffuse undifferentiated type. So there is a classification of non-Hodgkin's lymphoma. Coming to the etiology, that is the reason of why Hodgkin's lymphoma develops. It is most commonly of an unknown etiology, but rather they have been. It shows a multifactorial involvement. That is, it has been also observed in inherited conditions, that is from patients to the offspring. In these patients, when they have tried to know what exactly the reason behind this non-Hodgkin's lymphoma is, based on certain molecular diagnostic aids, they have observed that there is a genetic involvement because of the translocation of the chromosome 14 with 18 at the chart with the long arm of chromosome 14 showing its translocation to region 3 and band 2 with chromosome 18 that is with the long arm of chromosome 18 with region 2 and band 1. So this was a translocation which was observed in non-Hodgkin's lymphoma amongst those patients who have inherited from the parents to the offspring. So there is a genetic abnormality which has been observed. The next coming is, other than that, there were even environmental factors, that is on exposure to certain chemicals it was also been observed that these patients who are showing presence of non-Hodgkin's lymphoma, such as patients working in the plastic industry or with the petroleum industry or on exposure to pollutants, there have been presence of this non-Hodgkin's lymphoma mostly among those patients who have been exposed to these chemicals. Then coming as a immunodeficiency status also, when there's the patient is being comprised with any condition such as compromised immunodeficiencies, such as in HIV, we have seen that there was more these patients are more prone for developing Hodgkin's lymphoma. So based on the immunodeficiency conditions, it has been observed that these patients are more prone for development of the non-Hodgkin's lymphoma. So coming to the next disorders, they have observed that even patients suffering from connective tissue disorders like rheumatoid arthritis or systemic lupus erythematosus, these conditions have also been associated with non-Hodgkin's lymphoma. So based on this, connective tissue disorder has also been considered as one of the etiological agent for development of non-Hodgkin's lymphoma. Coming to the clinical features of non-Hodgkin's lymphoma, it was most commonly seen involving among the population above 50 years of age, with gender predilection showing towards the males when compared to the females, and there was associated lymphadenopathy, that is enlargement of the lymph nodes could be seen. Since it's a lymph node disorder, there was enlargement of the lymph node. And there are even other systemic symptoms, like patients who used to complain of, patients might give a history of fever, chills, malaise, night sweats, weight loss, fatigue. These were the systemic symptoms which are being observed in non-Hodgkin's lymphoma. Other than that, organ-specific symptoms can also be seen. That is involvement of the non-Hodgkin's lymphoma at particular areas. That is the central nervous system has been one of the reason where it could most commonly also involve. And based on that, there are even certain neurological systems, that is any alteration in the mental activity of the patients was even being observed. Then oral involvement has been seen, where the patient comes with a bad breath, and otherwise even with any involvement, that is diffuse nodule formation on exposure on any injury to this nodules. That was ulceration of the patient with bleeding in certain conditions. So these are the certain clinical features observed in non-Hodgkin's lymphoma. Coming to the patterns which have been seen in non-Hodgkin's lymphoma, there's been a nodular pattern. As the name itself suggests, that the neoplastic cells in the non-Hodgkin's lymphoma, they'll proliferate and result in a formation of nodule which occupies the lymph node in an area of lymph node. So this is known as nodular pattern. The next coming is a diffuse pattern, where we see that there is varied population of cells in this non-Hodgkin's lymphoma, where they show that rather than in a nodule kind of architecture, these neoplastic cells, rather they proliferate and they are scattered throughout the lymph node or the extra-organal sites, extranodal sites, wherever they have been involved, and this serves to be the diffuse pattern of non-Hodgkin's lymphoma. And next coming is a follicular or lymphoma nodular type, where we see that these neoplastic cells, they appear in the form of follicles, that is in different nodular patterns, separate nodules, which is being separated with a proper fibrous septa. And amongst this fibrous septa also, they are being produced, there are few scattered neoplastic cells present within the fibrous septa. So usually certain conditions, like as we have seen that in the lymphocyte predominant type, nodular lymphocyte predominant type of Hodgkin's lymphoma, which shows chronic relapses, it might progress into diffuse large B-cell lymphoma. So which shows that there are large number of predominantly present lymphocytes, among them which could be one variant which is predominant among them is B type of B-cell lymphocyte, and it is diffusely present, that is it is a predominant structure with which have been not circumscribed to a particular area, but that they are diffusely spread within the entire nodule or the lymph node. So these are certain histological features of non-Hodgkin's lymphoma. So there is a picture showing the non-Hodgkin's lymphoma, that is neoplastic proliferations in the form of nodules can be seen proliferating as separate follicles also can be seen in the H&E stain section here. And then the right side, the picture shows it's a grass specimen showing, which is almost irregular in shape, showing nodulated surface or lobulated surfaces, which appears pale whitish in color. On cut section, it might show grey whitish color with consistency which could be firm to soft in consistency. So coming to the treatment and prognosis of non-Hodgkin's lymphoma, usually there's a combination of treatment which is being given, such as radiotherapy, chemotherapy, as well as biological therapy. And amongst the biological therapy, it is based on the antibodies which has been given to the patient to fight against the host immune system. And there are two prognostic groups which have been divided. One is the indolent lymphomas and the aggressive lymphomas. Indolent lymphomas show better prognosis because of their indolent nature, and coming to the aggressive lymphomas, they have a poor prognosis because since they are aggressive in nature, they have more property to spread and result in even in occasional conditions, that is very rare percentages, they might show metastasis of this neoplastic proliferations. So coming to the differences between the Hodgkin's as well as the non-Hodgkin's lymphoma, it is very important to know to distinguish Hodgkin's from non-Hodgkin's lymphoma because of certain few similar features which have been observed in them. Based on the cell derivation, we see in Hodgkin's lymphoma it is mostly the cell predominant lymphocyte, it is a B cell lymphocyte, whereas in non-Hodgkin's lymphoma we see that it is 90% because of the B cell lymphocyte and 10% of the T lymphocytes which are composed within the neoplastic proliferation. Coming to the nodal involvement, usually we see that the patients, they show presence of localized nodal involvement in Hodgkin's lymphoma, which may spread to contiguous nodes based on its staging. But whereas in non-Hodgkin's lymphoma, we see that there's disseminated nodal spread, that is, they can spread carrying these foci of neoplastic cells throughout the lymph nodes or to the adjacent lymph nodes. The extranodal site involved in Hodgkin's lymphoma, it is mostly very uncommon, but whereas in non-Hodgkin's lymphoma, we see there's frequent involvement of the extranodal tissues. It could be organs or any tissues. The bone marrow, here we see a non-Hodgkin's lymphoma, it is not involved, but whereas in non-Hodgkin's lymphoma, there is infiltration of the neoplastic cells into the bone marrow. Then coming to the constitutional symptoms, usually they are very common in Hodgkin's lymphoma when compared to that of the non-Hodgkin's lymphoma. Coming to the chromosomal defects, it is usually because of aneuploidy, whereas in non-Hodgkin's lymphoma, we see there's translocation as well as deletion of certain chromosomes, since the genetic etiology is one of the major etiology which has been observed in patients with non-Hodgkin's lymphoma. Coming to the spillover, there's never spillover of the neoplastic cells, but rather in a non-Hodgkin's lymphoma, these neoplastic cells have a very much increased risk to spread through the hematogenesis, that is to the blood. They have a property of spreading since non-Hodgkin's lymphoma is a disseminated type of disorder. It most commonly spreads through blood. Coming to the prognosis, usually of Hodgkin's lymphoma, there is 75 to 80% of cure, and it gives a stage of better prognosis in these conditions, whereas in non-Hodgkin's lymphoma, it gives a bad prognosis where there is 30 to 40% of cure only in these patients. So these are the certain differences of Hodgkin's lymphoma with non-Hodgkin's lymphoma.